Thanks for joining us for this week's Community Crossroads. Here's a look at what you can expect on today's show. We'll find out how a local organization is helping victims of sexual assault. We'll learn what the Texas Mid-Coast Birding Festival has to offer. But first, we're talking about how you can help to support mental health services here in the Crossroads. So we're now joined by Lane Johnson, the Chief Clinical Officer with Gulf Bend Center. And thank you so much, Lane, for coming in. We appreciate it.
Good morning.
And we'll get to the specific event coming up, but Gulf Bend is such a vital piece to our community, helping with mental health needs. As concisely as you can, tell us, what does Gulf Bend offer? What is your role really in the community?
Well, there's not a single family that doesn't experience mental stress or mental illness at some point, whether it be severe psychosis or whether it be life adjustment problems. And Gulf Bend tries to meet all of those. We work with children, adults, all different kinds of adjustment disorders, mental illness. We also work with IDD population, intellectual and developmental disabilities, substance use programs. Whatever the needs and problems are, we try to craft something around that so we can help them.
And you work very closely with the Victoria Police Department, have staff that can assist them on calls maybe where it's a mental health situation. What are some other organizations that you work really closely with to make sure that someone trained in mental health is there to assist?
Well, right now we have an exciting program. It's in its second year where we're working with the Victoria Independent School District, where we're placing a mental health case manager on the campus, elementary school campus, who works side by side with parents as well as school counselors and teachers, called Bend the Trend. We're trying to find those kids that look like they're trending towards trouble, and by working with them begin to bend that trend to be more successful in school. Exciting program. In fact, we've just been invited to present it at our state convention later on in the summer.
Great. So does that blend over to the family as well if you find that maybe there's something else going on in that student's life? Oh,
absolutely. Parenting is a major issue where we can equip parents to manage and to work with their children in a more efficient and a better way. Because a lot of times parents, they just don't know what to do. They feel helpless. They don't have to be. They're skills that we can teach them.
Sure. Okay. What are some of the biggest health challenges that y'all are seeing right now?
Substance use is a strong need and problem. It's particularly acute substance treatment, someone who is really struggling with maintaining sobriety, and someplace they can spend each day working with a treatment team to help them get stabilized and help them move towards recovery. Also, we're noticing some significant problems with young kids in school, particularly emotional regulation. Kids seem to be having a lot of trouble feeling things and managing those feelings without just acting out and reacting. So that's why the Bend the Trend is important. We work with a lot of children trying to help them manage their own emotions and behavior, as well as their social relationships.
That can be harder as an adult sometimes.
No, yes.
Yeah, navigating that as a as a teenager or a child, definitely. So if someone feels that they need help or they have a loved one that they feel needs mental health support, how do they go about getting in touch with Gulf Bend or kind of starting that process?
All it takes is a phone call. The local number is 361-575-0611, or you can go online to gulfbend.org, and those contacts, we do have a 24-hour crisis hotline called 877-SAFE-GBC, because I forget the number, 723, I've got 3422. That phone call someone will answer and will triage what they're talking about and help them figure out, where do I start?
Okay, so great service here. And Gulf Bend has a great event coming up that will help support them and fulfill their mission. So coming up next, Lane is going to tell us a little bit about that. We'll be right back. We are back with Lane Johnson, Chief Clinical Officer for Gulf Bend Center here in Victoria. And now that we know more about the role that Gulf Bend plays in the community, tell us about this Shine the Light Walk and Resource Center that y'all have planned coming up, kind of what people can expect, how this helps to support your mission.
This is another important event. We've been doing Shine the Light since 2017. This will be our 7th year. If you do the math, it's been more than 7 years, but during COVID we had to cancel it for 2 years. But suicide is a significant problem in our community and in the country. It's the 3rd leading cause of death in this country. And one of the problems is most of us at times think about suicide, but no one knows how to talk about it and afraid to talk about it. So Shine the Light means we want to shine the light on this problem so that we can talk about it and we can help people. This is a walk that's on May 3rd in Riverside Park. The walk is about 1.25 miles. There's a rabbit trail if you want to go further and make it 1.5 miles. There's a resource fair down there, some 22, 23 exhibitors will be down there with resources, with games to play. It's an opportunity. There's a wall of fame for those who have lost someone to suicide, where we can remember those people and we can embrace the family. It's an attempt to take a very significant problem that is hard to talk about and just open it up so that we can strengthen ourselves as a community and deal with it.
For someone maybe who hasn't been touched by suicide or hasn't experienced anything like that, why is it so important for those people to still come out and learn about it and to be a part of an event like this?
Because sometimes people who have trouble with suicide, they look troubled. They may be somewhere where it's apparently that they're having trouble, but no one ever asks them, "Are you okay?" And that's all it takes. Someone who's thinking about suicide will not bring it up unless someone else does first. "Are you okay?" "Well, as a matter of fact, I'm not." And that's why it's important for people to understand this need so that we can reach out rather than wait for somebody to reach out to me.
Mm-hmm. So do people need to sign up to take part, or do they just show up the morning of May 3rd?
All of the above.
Okay.
You can sign up if you want to. You can register on gulfbend.org, or you can show up that morning. We start taking registration at 7:30. The walk will start about 7:45, and we'll be all wrapped up by 10 o'clock. Okay. So you still have the day.
So you can come by yourself, bring your family. If there's a group from work or a community group that you're involved in, yes. Lots of people, lots of different groups. And
join the crowd. We already have about 340 registrants already. So okay. It'll be a large group, have a lot of fun. Gary Moses will be our MC, of course.
Well, then it's official.
It's official, yes.
All right, and it is a free event to attend.
Absolutely, it is free.
Yes, okay. Well, thank you, Lane, so much for joining us. We hope that you have another very successful event.
Thank you very much.
Look forward to that. And thank you for everything that Gulf Bend is doing within our community to help with mental health resources.
Well, we're proud to do it. Thank you.
Thank you, Lane. Well, still to come, with April being Sexual Assault Awareness Month, we'll talk with a woman who is helping victims recover. Don't go away.